Hello, everyone. Um, I'm Dova Levin from the Myasthenia Gravis Foundation of America. I am the Senior National Director for Patient Programming and Education. We have a talk today on Talk Saves Lives. Our speaker is Sarah Clark. She is the Florida Panhandle and North Florida Area Director for the American Foundation for Suicide Prevention. Sarah has been with AFSP for over 10 years and works on fundraising, volunteer board development, educating the public about mental health and suicide prevention through AFSP programs, advocating for public policies in mental health and suicide prevention, and providing programs and resources to those affected by suicide. Sarah is also trained in ASSIST and Safe Talk, which are both suicide intervention trainings. Sarah graduated from Stetson University and has been in the nonprofit sector for 20 years. I just want to thank our sponsors for sponsoring these wellness series presentations: Alexion, Argenix, UCB, Horizon, and Advance in Neuroscience. I'm going to stop sharing and I'm going to let Sarah share her screen and go ahead with the presentation. Thank you, Sarah.
And can you see my screen, Dova?
I can see your screen and I can hear you.
Okay, perfect. Okay, so thank you all so much for attending this important conversation. Like Dova said, my name is Sarah Clark. I am the North Florida and Florida Panhandle Area Director for the American Foundation for Suicide Prevention. And I've been with AFSP for over about 11 years now. So I'm very thankful that you chose to attend this. And just a little housekeeping I do have a dog and all the blinds are closed and she is sleeping, but she can, if you hear barking or anything going on in the background, it will be her. So to get started, it's important to realize that suicide is a complex health issue. Despite its complexity, suicide can be prevented. Just like there are warning signs and risk factors for other health, like cardiac arrest, we can learn the warning signs and risk factors that can help us to prevent people from dying by suicide. As with other health issues, prevention can start early, far in advance of the problem, or prevention can occur closer to the time of the crisis. Time can be a critical and life-saving measure. Typically, a life can be saved if you allow time for the person's suicide risk to subside or to get through that period of distress and to get mental health help. To prevent suicide, we need to identify persons who may be suicidal, as well as take an active role in connecting them to help before they take action to end their life. The purpose of Talk Saves Lives is to provide community members with a general overview about suicide, who it affects, and what can be done to prevent it. Today, we're going to cover statistics to give you an idea of the problem and to give an overall scope of the problem of suicide. We will review some key research findings, including the risk and protective factors that relate to suicide. And we'll talk about what works and what we can all do to prevent this leading cause of death. So before we get started, I want to go over terminology that is used when we talk about suicide. It is important to model appropriate language so that we do not perpetuate the stigma of suicide or mental health. So let's establish a baseline of shared language on this topic. We avoid using the phrase committed suicide as it can have a negative connotation. Instead, we encourage the phrases died by suicide, ended their life, or killed themselves. When talking about suicide and suicide attempts, we avoid referring to suicide attempts as failed or successful. Not only is it unnecessary, but these words imply judgment. Instead, we encourage the use of phrases such as suicide attempt, suicide, death by suicide. Educating the public about suicide is critical for encouraging help seeking, raising awareness of risk in vulnerable populations, and advocating for new interventions and prevention strategies for those at risk. When suicide is talked about safely and accurately, we can help reduce the likelihood of its occurrence. We want to change how society understands mental health and suicide, because when we open up and connect, talk saves lives. Suicide is a significant issue that affects individuals, families, and communities worldwide. So let's start with some statistics that demonstrate the scope of the problem. Suicide is a global problem, and according to the World Health Organization, each year, over 800,000 people die by suicide worldwide. Most accurate data available, we estimate the numbers to be higher since suicide is underreported in many countries. That works out to a suicide every 40 seconds worldwide. In the United States, suicide rates are recorded by the Centers for Disease Control and Prevention. And according to CDC, 45,979 people died by suicide in 2020. This is the most recent data that we have available. This makes suicide the 12th leading cause of death in the United States. Suicide takes more lives in the US than homicide, war, and natural disasters combined. These numbers are one of many reasons that it is important to talk about suicide like any other cause of death. The more we talk, the less stigmatized the idea that we all face struggles and need support becomes. For every death by suicide, it's estimated that 25 others attempt. That's about 1 million Americans each year who survive a suicide attempt. When you think about any loss, it impacts many people in the community, and suicide is no different. The loss affects family, friends, co-workers, neighbors, schools, faith-based communities, and more. It is estimated that the majority of Americans experience a suicide loss over the course of their lifetime. So let's move on to research. Only in the past several decades have scientists been studying suicide. Research is shedding light on many critical areas, what drives up risk, and what that amounts to effective suicide prevention, and we still have more to learn. This section provides an overview of suicide prevention research, key research findings, and future goals in the field. One of the main questions research explores is, why do people take their own lives? And through research, we have learned that there is no single cause for suicide. Suicide most often occurs when several stressors and health issues converge to create an experience of hopelessness and despair. Research has consistently shown that the large majority of people who die by suicide have a mental health condition at the time of their death. It may or may not have been recognized by the person or their loved ones, may not have been diagnosed or adequately treated. That said, research has also made clear that mental health conditions cannot be the whole story. The vast majority of people who have these health conditions do not die by suicide. In addition to mental health conditions, there are many other factors that increase risk as well. We've learned that the brains of people who die by suicide differ from those who die from other causes in terms of structure and function, specifically in the areas related to stress response and impulse control. We've also learned that most people who are suicidal are ambivalent about taking their life. Part of them wants to live, part of them wants to die. This research has informed key strategies in suicide prevention that involve engaging the part that wants to stay alive and helping to create distance from the part of them that wants to die. One way we do that is to help the person connect with reasons for living, while at the same time decreasing the visibility and presence of things around them that may facilitate their desire to die. One of the many important things we have learned from research is about the perspective of a suicidal person, that a crisis point has been reached. For a suicidal person, it seems unbearable, whether it's emotional pain, physical pain, or sometimes both. For a moment, I'd like you to think back to the most physically painful experience of your life. At that moment, would you have been able to give someone clear and accurate directions to your house? Probably not. The pain makes ordinary thinking nearly impossible. And for a suicidal person, thinking becomes constricted at that moment of crisis, a state of intense tunnel vision where other options seem unavailable. Someone who considers suicide cannot foresee a time when that unbearable pain will end. Understanding the perspective of the suicidal person has also helped us to learn that suicidal feelings are often temporary. They can come on intensely and can sometimes pass in minutes or hours. Keeping people safe and helping them feel supported can get them through those critical moments. There is evidence that putting time and distance between an individual who is suicidal and the means to take their life can be a life-saving action. This is why it is so important that we take steps when we know someone is struggling to help keep them safe. Research has also helped determine the key factors that increase the risk for suicide. Risk factors are defined as characteristics or conditions that increase the chance a person may take their life. Risk factors are important to know to understand the big picture of someone who is considering suicide. Just like someone who is at risk for heart disease because of high blood pressure or a history of heart disease in the family, some people are at higher risk for suicide than others. The main risk factors shown here can be grouped into three categories: health factors, historical factors, and environmental factors. These risk factors can converge at different times in life and increase a person's risk for suicidal behavior at particular points in time. The first type of risk factors include health factors, such as biological and psychological medical conditions, the most significant of which are mental health conditions. As we said before, most people who die by suicide have an active mental health problem at the time of their death. Depression is the most common mental health condition and the one that is most associated with suicide. Bipolar disorder is also shown to be at high risk, although the disorder is less common than depression. Because these conditions put a person at greater risk for suicide, detecting the presence of a mental health condition is critically important. The best way to be sure when you feel concerned or detect a possible change in you or your loved one's mental health is for the person at risk to seek a professional evaluation and receive effective treatment. Many people may not realize that their distress has actually become a health problem. Providing information about how to access mental health care or a crisis number if their distress is high can be a solid step in helping them connect to the help that they need. Mental health, Mental health conditions are not the only health factors that are associated with suicide risk. Serious or chronic health conditions can increase risk, especially when the person also has mental health issues. Chronic pain and injuries have also been found to increase the risk for suicide. The second type of risk factors include historical factors, such as a family history of suicide, a family history of mental health conditions, or past trauma, such as sexual abuse or combat stress. Research has also found that a history of childhood abuse can contribute to suicide risk. And while most people who attempt suicide do not go on to die by suicide, previous suicide attempts are also considered historical risk factors for suicide and also put a person at an increased risk. The third type of risk factors are environmental factors that involve the circumstances of a person's life. Often there are aspects of a person's environment that can contribute to their overall level of risk. A few of the most are having access to a way of killing oneself is referred to as access to lethal means. This includes having access to a variety of things such as firearms, drugs, a bridge, a car, etc. Research has shown that contagion, the exposure to another person's suicide, or an exposure to a too graphic or sensationalized account of suicide, especially among those with other risk factors, can increase a person's risk of suicide. Prolonged stress may include harassment, bullying, relationship problems, legal problems, and unemployment. Stressful life events, which vary across the lifespan, include experiences like divorce, legal problems, or job loss. To better understand suicide risk, here's an example of a set of risk factors that could converge in a person who is suicidal. This is what is often the public perception of suicide. When someone dies by suicide, often the story only talks about the environmental factors. People see a life event like a breakup or bullying or job loss, and then they see the person die by suicide. So they might assume that person killed themselves because of that one life stressful event. But that's never the full story. What others don't know is that the person who died may have had genetic risk for suicide. Maybe they were suffering from depression and anxiety disorders, and their work life had become increasingly stressful. Their underlying depression and anxiety could have made the situation at work even worse, or the work stress could have made their depression worse. And perhaps they'd also been drinking more than normal. The key is that the combination of risk factors could have contributed to the suicide death. Therefore, while one life event can play a precipitating role for suicidal behavior, without other underlying risk factors, life events alone aren't thought to cause suicide. Looking to the future, research will help us find the best ways to fight suicide. Research is looking for biomarkers, for example, something testable on a blood sample, that would help us to identify a number of clinical treatments like particular types of therapy are effective for suicidal people, and more need to be developed and studied. The good news is that through research, we are learning more and more about what helps those who are in a suicidal crisis. Research can also help us to identify the most effective programs and interventions to reduce suicide rates and to reduce risk in those suffering from mental health conditions. Now let's move on to prevention. Just like there are risk factors that increase a person's risk for suicide, there are also protective factors that lower a person's risk. If you are proactive about your mental health and make an effort, you protect yourself. Feeling connected to family and community support can protect against suicide. When someone is struggling with depression, anxiety, psychosis, or substance abuse, these protective factors that may normally be strong can erode and temporarily weaken. When that happens, having friends and family to remind us of our strengths can be a tremendous protective factor. Problem-solving skills also help. Life can get really tough, but being able to see a way through problems can be a protective factor. Cultural and religious beliefs that encourage connection and help seeking and discourage suicidal behavior or help to create a strong sense of purpose can also be a protective factor. Because mental health care is so important for preventing suicide, we are going to focus on this topic for the next few minutes. Getting effective treatment for mental health conditions like depression or anxiety can prevent suicide. Critical to suicide prevention is getting people connected to mental health treatments. One of the biggest challenges in fighting suicide is getting people to address their mental health in the same way they would for their physical health. In fact, of those suffering from a mental health condition, less than half seek treatment. One way to encourage individuals to seek help for their mental health conditions is to treat mental health like any other aspect of our health. There are certain times when a person becomes ill, and it's critical to seek a trained professional. We need a culture where everyone knows it's smart to take care of our mental health. Taking care of our mental health is just as important as taking care of our physical health. And seeing a mental health professional is a sign of strength, and many are taking that step. The person helps to request a thorough evaluation to figure out if there is a mental health condition that is affecting their life. There are many types of treatments available, like various kinds of psychotherapy, counseling, and medications. Research has shown that for many people, the combination of both counseling and medications tend to be the most helpful. But what the most important thing is to find the treatment that works best for the individual. The good news is that advocacy efforts are improving access to mental health services so that more people can get the treatment that they need. The law now requires insurance plans to cover mental health services on par with physical health services. If we need mental health, and 1 out of 4 of us will at some point, we should get treated and get our health back on track faster. Just like people can find strategies that optimize their physical health, people can do the same for their mental health. In addition to professional mental health care, proactive self-care strategies like good sleep habits, exercise, nutrition, and stress management play a critical role in protecting mental health and promoting resilience. Prevention efforts also include support for those touched by suicide. The loss of one person to suicide profoundly impacts many, and it's important that survivors of suicide loss have the support that they need, both to heal and to reduce their own suicide risk. And since those with lived experience, or those who have attempted suicide, or who are experiencing suicidal thinking, are at an increased risk, we need to make sure that they have the support that they need too. For most people who are at a crisis point, the most important thing you can put between a suicidal person and their way of ending their life is time. Research shows that by temporarily reducing a suicidal person's access to lethal means, we give suicidal individuals time for the intense suicidal risk to diminish, and time for someone to intervene with mental health support and resources. For the majority of people who experience a suicidal crisis, if unable to access their chosen method, even temporarily, they are unlikely to engage in another action to end their life. In most cases, when a suicidal person doesn't have current access to the means that has been on their mind, they don't substitute it with another method. Therefore, a clear way to prevent suicide is to limit access to lethal means. During a period of high risk, the safer their environment is, the better chance a suicidal person has of living through that crisis period. Suicide prevention research has looked at a number of ways to create safer environments. Install inexpensive carbon monoxide sensors that would automatically shut cars off if carbon monoxide levels reached unsafe levels would save lives. We've learned through research that installing barriers on bridges deters suicides, and in many cases, bridge barriers actually lower the suicide rate for the entire region. Restricting access to potentially lethal medications reduces suicides and can be as simple as requiring lethal drugs to be sold in blister packaging. Firearm safety is critical to reducing suicide rates. In the United States, firearms are used in roughly half of all suicides, making suicide prevention an important part of gun safety education. As noted already, and contrary to what you may think, when access to lethal means are limited, most people who are suicidal do not find other means. Therefore, the suicide death does not occur in that moment, and it allows more time for the person in crisis to get connected to help. Now that we have reviewed key suicide prevention efforts, let's talk about what we all can do to help prevent suicide. It's important to have a caring, supportive conversation with someone you might be worried about, to allow them to share what they are experiencing. A conversation is a way to show you care and allows you to gain more information about their level of distress. Let's start by talking about suicide warning signs. Watch for the warning signs in yourself and in others. While many of the suicide risk factors we discussed endure over a longer period of time, warning signs are observable signs that suicidal risk is in the near future. It's important to pay attention to both the risk factors discussed earlier and the warning signs we are talking about right now. If you see warning signs, reach out to individuals in your life you're concerned about and reach out to others if you're struggling. Seek mental health services if you are depressed or if your anxiety regularly interferes with your daily life, and encourage others to do the same. Suicide warning signs are typically displayed in three main ways that we can detect: through talk, behavior, and mood. Many people who are suicidal talk about ending their lives. This may be directly or indirectly. A person might say it outright, or they might joke about it. Take it seriously. People say they have no reason to live. Others say things that let you know they may feel trapped or that they are a burden to others. Or they might also talk about feeling overwhelmed or being in unbearable pain. Behaviors that are atypical for an individual should also encourage you to speak to the person about what you are noticing. People thinking about suicide can display certain behaviors. There may be an increased use of drugs. They may have trouble sleeping, either experiencing insomnia or sleeping too much. They may start acting more recklessly. They might withdraw from activities, especially activities that they normally enjoy. They might isolate themselves from family and friends. They also might look for a way to kill themselves, such as searching online for methods or shopping for a firearm. They may also give away their possessions or show a related behavior, such as reckless spending. People at risk for suicide can display, and often quite subtly, any of the following moods: depression, apathy, rage, irritability, impulsivity, humiliation, anxiety. Moods one would expect of someone who feels overwhelmed and desperate. We all have ups and downs in our mood, but when you notice a change that seems uncharacteristic or concerning, it is important to speak to the person about what you are noticing. For example, sudden unexplained happiness could indicate the individual has decided on a plan and is relieved they will no longer be in pain. That's a lot of things to look for. So to sum it up, look for changes in behavior and trust your instincts. Assume you are the only one who is going to reach out. In too many instances, people talk for someone amongst themselves, but hesitated to reach out to that person directly. So a good rule of thumb is, if you are wondering if someone is depressed or overly anxious, that's a sign you should reach out. And the same goes for you. If you are having suicidal thoughts, that's a sign that you need to seek help. If you have reached out before, reach out again. The first time the person may not be receptive. Keep trying. Try talking to someone else or with a professional. And even if suicide turns out not to be a concern, they may still be in distress, and they may feel comforted and supported just by knowing that you care and that you're taking the time to listen. So how do you reach out to someone? Talk to them in private, listen to their story, express concern and caring, and ask about suicidal thoughts. Don't be afraid to ask the question, are you thinking of ending your life? Encourage them to seek mental health services, and if in crisis, take them to help. There are some things to avoid when talking with someone who may be suffering from depression or anxiety. Avoid minimizing their feelings. Those of us who have never experienced major depression literally cannot imagine what it feels like. Avoid trying to convince them that life is worth living. If a person is nearing a crisis point, they are not thinking clearly. Philosophical debates about life being worth living tend not to be helpful. Avoid advice to fix it. If the person is having a heart attack, you wouldn't tell them right then to start exercising or to eat a healthier diet. If they are in crisis, what they need is to be heard and then led to help. Listen to their story and offer to help them find a health professional. Help them take active steps toward keeping their environment safe. If you think they might make an attempt on their life soon, stay with them and do not leave them alone. However, if the situation puts your own safety at risk, leave the area and call 911. Help them remove themselves from potentially dangerous areas and escort them to mental health services or an emergency room. Help them call the lifeline or call the lifeline yourself, and a trained counselor will tell you what you should do to help the person in distress. If they don't feel comfortable speaking to a counselor on the phone, they can also text TALK to the crisis text line at 741-741. If you want a picture of this screen, that would be great. That way you have this information handy. Both the lifeline and the crisis text line are open 24 hours a day, 7 days a week, 365 days a year. They are always available and can help direct you to resources that are in your area and not in your area, as well as just be a caring person on the other side of the phone. Of course, if it's an emergency, such as a suicide attempt in progress, call 911. Together, we can create a culture that's smart about mental health. We'll save lives and vastly improve the lives of many more. It's a simple yet powerful idea, but talk saves lives. By caring and reaching out, we can all play a part in suicide prevention. And that concludes the presentation. And Dova, I don't know if you have any questions.
I do have questions. So I'm not sure if the chat box is working. I got a message from someone saying that it was not, but I have some questions from that I can ask you. So the 988, could you put that slide back up?
Sure.
The 988 slide. So can you talk about this? This is a fairly new service, is that correct?
Yes. So it used to be a 1-800-273-TALK. It used to be a very long number. And we have advocated and gone to Capitol Hill and all of our state legislators, and we were really advocating, along with other groups, to really bring down this number to a 3-digit line. Because when someone is in crisis, it's hard to remember a long number. But just like with 911, you can remember 988. And so this is new, but it's a much quicker, easier access number for people who are in crisis.
And it works nationwide, correct?
Yes.
Yep.
Yep.
And when the people answer, are the people that answer in your local area?
They might not be in your local area, but they will have resources and can direct you to help and support in your area.
Okay.
It really depends on how many call centers are in your state, and that varies by state.
Okay, great. And you can also call, if it's not for yourself, you can still call for someone if you're concerned about someone?
Yeah, so if you're like, if I was concerned about someone, or maybe I was with that person and they didn't want to call, I could call and get resources and support, or they might be able to help me with what I can do to help them. So it's
great.
For the person in crisis, it's for anyone to call.
So our patients, have a chronic disease. Do you have any, information or tips for those people that, they're dealing with a chronic disease, which could bring on depression, you know, where they're just feeling sometimes like they need some extra help. So I guess I'm just wondering if you have any experience or can talk to that issue.
I mean, I think just like I said earlier, it's important to take care of your physical health, just like take care of your mental health, just as importantly as your physical health. So if you are noticing these signs, or if you're starting to feel, you know, down or depressed, or you're just, you know, noticing these things, it's important that you can talk to your doctor about this. And most doctors are really doing a much better job. Like I know when I go to my doctor's appointments, I have to fill out a screening form, you know, while I'm in the waiting room of, you know, on a scale of 1 to 10, how anxious are you? You know, so I do think you can always just talk to your general doctor, and they can provide resources for you as well. And they can also direct you to resources.
Oh, that's great. Yeah, I agree. When I go to the doctor there, they tend to ask now, you know,
Yeah.
ask the questions, or it's on a form that, and people should feel very comfortable answering those truthfully.
Mhm.
It seems that our chat is disabled for this call, and I'm not sure why, but, if we get some follow-up questions, Sarah, I may shoot them over to you by email and just see if, we can get them answered. We will have this, recording posted on our website, so people can watch it, at a later time. Hopefully some of our support groups will, be able to play it for at their meetings. So Sarah, thank you so much for your time. We always appreciate it. We've had you speak for us before, and you're always, fantastic. So thanks everyone, and, thank you, Sarah.
Thank you.
All right. See you soon. Bye-bye.